wanted to ask you about the Big Beautiful Bill's impact on healthcare in Idaho.
On healthcare?
On healthcare, yes, sir. The chief medical officer for St. Luke said it will have a negative impact on healthcare delivery in Idaho, and the Idaho Hospital Association said an estimated 75,000 Idahoans could become uninsured. Are you concerned about those Idahoans that could become uninsured under this bill?
No, that data is simply not accurate. The fact is that the only reforms to Medicaid that we made were to stop states that were gaming the system, and by the way, Idaho wasn't one of those states, by using state-directed payments in a way that was diverting money away from Medicaid and away from the federal government in what I consider to be a gimmick. Let me also point out that there is a problem in rural hospitals. Mm-hmm. That problem far predated the One Big Beautiful Bill. They have a problem because they don't have enough traffic, if you will, enough healthcare traffic into their hospitals to help sustain an economically viable system. Mm-hmm. And there are other issues as well in rural America. We created a $50 billion rural hospital support program that will give every state significant new resources to help those rural hospitals where they need help. And so I just don't understand the arguments that are being made about the fact that our hospitals are going to face this kind of trouble. I think it is a reaction to some of the legacy media reporting on this that says that a lot of people will leave Medicaid. Here's the people who we stopped from getting on Medicaid. People who are not American citizens and are not legally in the country. People who are registered in more than one state to receive a benefit, and we require them to simply register in the state they live in. And then we require that the Medicaid system go through its records every 6 months instead of every year to identify people who have graduated from the program and need to be removed from the rolls. Mm-hmm. And they would be removed from the rolls anyway. And so my point is, the other thing we did is we imposed a work requirement. The work requirement has been shown to work in our entitlement systems for more than 2 decades. It started under President Obama, and so in some programs, and then it was removed. And so the work programs are possibly going to cause some people to leave Medicaid, but if they leave Medicaid, most of them will be leaving because they got employment that provided them insurance. Mm-hmm. And so the argument that people will be losing their health care is simply not a valid argument.